Good evening. My name is Mark Burish. I'm here with Jason Zenobia, and it is Cluster Headache Awareness Day. And so no better day to talk about cluster headache with the American Migraine Foundation. So thank you all for joining in and welcome. We're going to talk kind of in three parts tonight. The first part is I'm going to give a brief presentation on cluster headache. What is it? How common is it? How do we treat it? And then Jason, who is a cluster headache sufferer himself and an advocate, is going to give his kind of version on and his perspective on what it's like to actually go through having cluster headaches. And then finally, we're going to do a little question and answer. So let me start with cluster headache and what it is. So many of you have probably seen disclosure slides before, but if you haven't, this is meant to show you any kinds of conflicts I might have with the topic we're discussing today. So I do get some research support from a nonprofit here in Houston. I'm a consultant for several companies, including the American Headache Society, which is closely linked with the American Migraine Foundation. I have gotten some journal fees, and I am involved in a couple of clinical trials, which we will not really be discussing today. For an outline today, we're going to keep it pretty simple. We're going to have one slide on epidemiology, how common is cluster headache, and so on. A little bit about how you diagnose cluster headache, what are the symptoms involved with it, and finally a little bit about treatment and a couple of slides on what the mechanism is behind cluster headache. So let's start a little bit with epidemiology. So cluster headache is found in 1 in 1,000 people. So that means your risk is 1 in 1,000 for developing cluster headache. That may seem rare, but it's actually 1 in 1,000 is not that rare. That's about 330,000 Americans. And you may think this is rare because you haven't heard of it before or is not too commonly discussed, but Parkinson's is about 2 in 1,000 people, multiple sclerosis is about 1 in 1,000 people. So that's 2 in 1,000, 1 in 1,000, that's things that you've heard of before. It seems to have its onset somewhere between kind of your teens and your 40s, mainly in your 20s and 30s. So on this horizontal axis here, this is age in years and kind of 5-year bins, so 1 through 5, 6 through 10, and so on. And here is kind of the number of respondents in this study. And you can see the peak for both men and women is kind of in their teens and 20s. It's much more common in men overall, as you can see. So it's about 2.5 times more common in men for reasons that we don't understand. And this being the American Migraine Foundation, you probably know that migraine is the opposite. So migraine is much more common for women for reasons that are not entirely clear. And then finally, 55 to 64%, I think this is a very serious epidemiology fact, contemplate suicide. So just take a second to think about that. This is a disease where over half of patients talk about suicide. And Jason, you may get into this, you may not. It's a hard topic, I think, sometimes to discuss. So let me describe cluster headache for the audience. There's no test for cluster headache. There's no blood test that says you're positive for cluster headache or a imaging test that says you're positive. We do those things to rule out other headaches. This is an old school medicine. You tell a physician or a medical provider what symptoms you have, and they say, well, that sounds like cluster headache. So there's an official list of symptoms. So let's go through them here. So you have at least 5 attacks. So if you only had 1 or 2, we don't know what it is yet. You have severe or very severe pain around your eye, above your eye, or in the temple that lasts somewhere between 15 minutes and 3 hours. There was a study last year that we were involved in that simply asked cluster headache patients, how painful is cluster headache on a scale of 1 to 10? And you can see here, almost everyone rated it 9 or 10. So most people said this is about as extreme as it gets. Then we asked, have you had other headaches? Have you had other types of pain? And how painful are those? And can you rank those for us? And the number 2 on the list was childbirth. And you can see that was a lot lower than cluster headache was. So the most painful things you can think of, childbirth, kidney stones, gunshot wounds, and heart attacks are much, much lower on the list. Cluster headache is an extreme amount of pain. again, as someone who personally does not have cluster headaches, I can't begin to explain, but cluster headache patients have sometimes come up with their own headaches or pain scales because 10 is just not enough for a lot of people. Then in addition to the pain, there are these changes that happen on that side of the face. So the pain's on one side, and you get all these other changes on the same side of the face. And I kind of have this diagram here to show it. On the same side, you might get a red eye or a watery eye. And you kind of see this guy's pain is on the right side, so he's got this kind of red eye and watery eye. You get nasal congestion or a runny nose. You get edema or kind of puffiness around the eye. You get this facial sweating, so you kind of sweat just on that side of the face. And then you get this miosis or ptosis, which is the miosis is the small pupil, and the ptosis is kind of a droopy eyelid. And not everybody gets all of them, but you might have at least one of them that kind of goes along with your headaches. Here's an image of a patient during a cluster headache, and you can kind of see some of these. There's kind of a red eye here as opposed to the hot side that doesn't hurt. The eye is a little bit droopy here, a little kind of puffy around the eye, but he's got a lot of those symptoms that you kind of see over here. And then there's this restlessness component to the headaches. Patients really can't sit still. That's very different from migraine, where patients really want to sit still because sometimes moving makes it a lot worse. But I'm going to show 4 different videos of 4 patients with cluster headache who each, as you can kind of see in these videos, can't sit still. And for those of you who have cluster headache, I apologize in advance. These are sometimes very hard to watch for people who have them themselves, but I wanted to convey kind of what this was like. So that's one. Let me kind of show the next one on the list here.
Difficult to watch, often unbearable to experience. The pain of a cluster headache can be indescribable. Some sufferers post videos showing an attack to try and convey the reality. We're using these with their permission.
So you can see can't sit still. Here's a different one from the same report.
It's estimated there are around 130,000 sufferers in the UK, possibly more, as the condition is often misdiagnosed.
And then finally, I'm going to show this last one. One thing you can kind of see already, there's 3 hands in this photo or in this video. In the comments, the person who generated this said that she asks someone to hit her in the head during the headache because it helps the pain. So he's not doing that kind of on his own. She'd asked him to do that. And then she's wearing this big mask. She's wearing oxygen because oxygen is an effective treatment for a lot of patients. But you can kind of see, I mean, first of all, everyone's holding their eye, but no one's sitting still. And that's kind of the point I'm trying to make with these videos. But that's another component. Not everyone has it, but most patients will get kind of restless or sit still. They're not outwardly violent. It's just they just can't sit still. Other than that, there's this sense of there's this timing to them. So they happen sometime between once a day. I apologize, the videos sometimes take a little while to move on. But it happens between 1 time a day and 8 times a day. And that's because there's some other headaches that are very, very similar to cluster headache. And you kind of see them on the spectrum here. They all have those changes on one side of the face. They all have one-sided pain. Most of them have that restlessness, but they're treated very, very differently. There's this medication called indomethacin, which is very, very effective for 2 of them, the ones that have hemicrania in the names, but not effective for cluster or kind of a couple of the other ones. And these are separated out by kind of how long they last and how many times a day. So this kind of helps separate it from some of the other headaches and lets you know should you use indomethacin or not. And then finally, there's this, they always put this in here, you know, not better accounted for by another headache. Sometimes there are headaches that look like this, but are not actually cluster headache. If you just had a concussion, you can get headaches that kind of look like cluster headache for a short period of time. So there are a couple other features that are not official, but are seen very often in cluster headache. So one is that there's this very quick on and off, so the headaches come on very quickly and they shut off very quickly. There are some triggers. So alcohol triggers a headache very quickly, often within an hour. I've had patients say, before I finish my beer, I've got a headache. Nitroglycerin, which is used for heart disease sometimes, and sometimes patients say if they go at altitude or on a plane flight or something. A lot of patients have a version of cluster headache called episodic, and Jason's one of those people that has episodic cluster headache, which means that they get headaches for, you know, every day or every other day for weeks or months at a time, and then it goes away for weeks or months at a time, and then it comes back. That's where the name cluster got its name. It's kind of as if the headaches are clustering together. And interestingly enough, it's only when you're in cycle that these things trigger it. Outside of the cycle, you can drink all the alcohol you want. I'm a physician, so within moderation, but you can drink all the alcohol you want. You'll never trigger a cluster headache. Migraine features are seen in cluster headache. Sometimes patients will say they get light sensitivity or noise or nausea and vomiting. So that's not a great way to separate it out from migraine. And then finally, there's this very odd timing to the attack. So if you kind of look at the 24 hours in a day and ask patients, you know, how common do you, or when do you get your headaches? Most of the time it's 2 a.m. But a single patient will tell you it's the same time. So patient number 1 will tell you it's 2 a.m. every day. Patient number 2 will tell you it's, you know, it's 3 in the afternoon. But this was a study in the United States. Here's a study in Denmark, most common time 2 a.m. Study in Sweden, most common time 2 a.m. Germany, kind of 1 to 6, but 2 a.m. is in there. Taiwan, kind of midnight, but 2 a.m. is in there. It doesn't matter what time zone, it doesn't matter. It's this odd timing that we don't quite understand. So let's talk a little bit about and finish up on kind of treatments. So I'm going to show you the medicine, the kind of official American guidelines and European guidelines because they differ a little bit, and then what patients have said that helps. So the American and European guidelines are based on how many publications and how good are the publications. The patients are just telling you how effective was it. So on the as needed or aborted, things that are meant to abort or break the headache, oxygen and injectable sumatriptan injected under the skin, these were far and away the ones that everybody liked the most, the Americans, the Europeans, patients. The oxygen may actually be higher because they used a pretty low flow in this study, but you really need a lot of oxygen. So that little thing that goes in the nose is really not going to do the trick. And then there's some other types of triptan medicines, but the injectable is the best. Sometimes people use lidocaine nasal, but you can see that patients didn't really like it that much. And there's some newer things like a stimulator that just, they're too new to make the list. This is a wearable device that goes on your neck. There's some kind of short acting medications. So these will kind of keep the headaches at bay for a week or two, but you can't take them really any longer than that because they start to become dangerous. So one is kind of in steroids, either an injection or pills, or ergotamine, which is similar to the triptans. And then finally, there are a bunch of preventives. Verapamil, which is a blood pressure medication, is probably the most effective. People have also tried lithium or topiramate, which are, this is used for manic depression or bipolar disease, which is also a cyclical disease, which is kind of interesting. Topiramate is also used for migraine and seizures. Galcanezumab is kind of a newer medication that's injected that just was too new to make the list. And valproic acid, actually, the Americans did not like it. They thought it was not that effective. And then when nothing works, when you've really tried a lot of these things and are still suffering, there are a few other treatments. These are implantable stimulators. The one that goes under the cheek, this one unfortunately is not available right now just because of company issues. There's some new studies now, occipital nerve stimulators. So those are kind of what are used most often now. And then the Americans actually did not like the hypothalamic stimulator. But these are kind of the treatment options that we have. And you can see that, you know, some of the things like the preventives just aren't great. We don't have the best medications for a lot of patients. A lot of this, and I'm not going to go over it all, has actually come out in the last 5 years. So there's been some new things with getting oxygen approved. There's been new trials of these stimulators and these antibodies are injected, new studies of steroids. So there is a lot of research in this area right now. We just are trying to find better treatments. So I will finish there. Well, actually, let me talk about the patient experience. That kind of segues into what Jason is going to talk about, which is his experience. But these are therapies that have not been used in clinical trials. Nobody really knows how effective they are, but patients have talked about them. So the high-dose caffeine, magic mushrooms or LSD, which are not legal in most parts of the country, at least for the United States, although they are being decriminalized in some places, vitamin D or diphenhydramine. But again, no studies have been done on these, and sometimes they're illegal to obtain. So I'll finish there, and I just appreciate your paying attention, you're listening in. I want to turn now over to kind of a more powerful voice, I think, which is Jason, who is a cluster headache sufferer and an advocate. Just for Jason, your thoughts.
Thank you very much, Mark. I appreciate you being here to talk today, and that this is Cluster Headache Awareness Day. It's a great opportunity for us to really get people knowing more about the situation. So like Mark said, I am an episodic cluster headache sufferer, and I have been since I was about 13 years old. I know exactly where I was when I had my first attack, and the pain was excruciating, just absolutely off the scale. I was in school trying to take a test, and I flunked the test. I wasn't able to concentrate. For many, many years, as is typical for cluster people, I was misdiagnosed as a migraine sufferer. And yeah, again, that's very typical. And I did find that the migraine medications and treatments really didn't help me in any way. Although I had heard that oxygen could help migraine sufferers, it took me many years before I was allowed to use oxygen. And I think part of what led to me being misdiagnosed was that my brother suffers from migraines, but not very severely, and my father was a migraine sufferer. So a history of that in the family just kind of, I think, led naturally to a misunderstanding of my situation. So I was eventually diagnosed by a neurologist here in Portland, Oregon. I believe he referred to it as cluster migraine, and he kept prescribing medications for migraines for me, the ergotamine drugs and a drug called Maxalt, and those didn't work for me. And in fact, Maxalt made my attack that night much worse, which is really off the scale. But eventually I found a doctor. When my neurologist retired, I got a new doctor who finally prescribed oxygen for me and began gearing my treatment toward cluster headache. And it was really, I believe, about 5 years ago when I first got an oxygen tank into my house and was able to breathe it with the mask at the onset of a headache. And my headache aborted within about 8 minutes. And I was so overwhelmed that something finally was effective in dealing with my condition that I started weeping uncontrollably. And my husband was very alarmed at this and ran into the bedroom and asked me what was wrong. And I couldn't even speak because I was so overwhelmed that the oxygen therapy was working for me. So it was a very emotional experience to finally have some tools that could address my situation, which up to that point had been so bad that, like the sufferer in I believe the final video that we saw, I would smash my head against the wall while I was having attacks because the pain of that impact, I'm not sure why, but it seemed helpful. in dealing with the pain of the headache, which my experience of that pain is, I appreciate the 1 to 10 scale, but I really would have to say that for me, on a scale of 1 to 10, my experience of cluster is about 100 or 1,000. There is no other pain that I've ever experienced physically in my life that even compares to it. And I don't mean to upset anyone, but to describe it, my experience of cluster is the sensation of someone trying to cut my right eye out of its socket with a knife. And I can't get away from it. I can't stop them. I can't do anything to deal with the pain. It's unendurable, except I have to endure it. And unfortunately, what Mark was saying earlier about suicidal ideation does apply to me as well, although not lately, since I now have effective treatment. But the intensity of the pain is akin to having surgery while you're awake. And the level of panic and horror around that pain is enough that I really stop being rational if I'm in a full-blown attack. And I have not been a danger to myself, but I wouldn't want to have a cluster attack if I was on top of a tall building or in the middle of a bridge. That would be very dangerous for me. I would say the social and emotional impact is that experiencing cluster headache is very isolating in that it is not very well understood. I don't believe that pain and suffering are competitive sports, but my experience of cluster is much more painful than what I understand migraine to be. But I also I don't want to minimize anyone else's suffering. It's very important that I say that. um, my experience in cluster when I'm in a cycle is that I will have a headache every single night without fail. My attacks are triggered by sleep, or even sometimes relaxation will trigger an attack. So while I'm in cycle, it's very difficult for me to go to bed. It's kind of terrifying to me to even get under the covers, put my head down on my pillow, and try to go to sleep. Even entering my bedroom can be very frightening. And that is an ongoing traumatic stress during my cycles. But I would say that the importance of the support that I've found in talking to fellow sufferers has been critical. Just knowing that my experience is typical of other cluster sufferers, and that the pain levels that I feel when I'm having an attack are the fact that they are so extreme is both horrifying to me and comforting to know, because I know that it really is an extraordinary pain, and that my extreme reaction to it is not a function of me being weak or damaged in some way. It's that this is a truly horrific condition. They call them suicide headaches for a reason. But I am very fortunate that oxygen treatment works for me very well. The galcanezumab, my last cycle last year, which lasted 3 months, was the first time I was able to start injections of Emgality, or galcanezumab, which I still learning to pronounce. But the data that I kept from that cycle, which lasted 90 days, showed that I had 26 nights where I didn't get a headache. And I'm not a clinical study, I'm just one person, but that's unprecedented for me. I've never in the history of my cycles had a night off. So to have a third reduction on Emgality is really remarkable to me. In addition, the attacks that I did have last year during my cycle were not as severe as what I'm used to. Normally, they are off the scale painful. My pain documentation from my last cycle showed that I only had 5 headaches of that caliber. So at the very least, something's going on, and I hope it's the Emgality. Sumatriptan is also an effective treatment for me. The injectable works very well. I also happen to be one of the people for whom sexual arousal and sometimes climax or orgasm can abort my headaches as well. That doesn't work for everybody. And it's also difficult to be aroused when you're in agony. So not the best treatment, but I prefer it to sumatriptan, which is not a pleasant drug to be on. And then I would just finish up by saying what I want people to know about cluster. First of all, it's not a headache. It's not a migraine. And again, pain and suffering are not a competitive sport. I don't think it's important to be more or less than someone else in that way. But the pain of cluster is truly astonishing. And it can be deadly. People who suffer from cluster are much more likely to have suicidal ideation and to actually kill themselves. I had a cycle a few years ago that lasted 8 months, and that was the longest cycle I've endured. It was before I had a lot of these treatments that did any good for me. And toward the end of that cycle, I was very worried that I was becoming chronic. And I seriously wondered whether I had the strength to keep living under those conditions. And so that is very important to keep in mind. Anecdotally, toward the end of my experience when I was in college, I did consume some psilocybin mushrooms in about 1993, and I did not have a cluster headache for 10 years after that. So I'm glad that the state of Oregon, where I live, is legalizing psilocybin mushrooms, and that it is my hope that there will be some real clinical research done along those lines. And I guess that's everything I was going to say. And I thank you all for your time and for being here to listen. I hope what I said can help.
Thanks, Jason. I mean, you can say it much more powerfully than I can just list the different things or even show you graphs about how much people can say it. I mean, it's just so much more powerful to hear it from you. So thank you for being here. I appreciate it.
Thank you.